Hello, my name is Josh Falwell, and I'm going to be doing a quick presentation on the effect of exercise on Parkinson's disease. Before we get into Parkinson's disease, I kind of want to give a little background on what it is and kind of the effects of neurological diseases in general. So, like I just mentioned, Parkinson's disease is a neurological disease that is progressive and involves damage to the nerves in the brain, resulting in impaired skeletal muscle movement, which is usually indicated by a tremor. Other signs of Parkinson's disease are kind of a forward lean, a shuffle when you walk, trouble with gait, just other musculoskeletal problems that can arise. It is common and it's seen in more than 200,000 cases every year. And what I say here, symptoms usually begin at one point and get much worse. That just means that it is progressive and it will continually get worse. Your symptoms, your musculoskeletal condition will continue to get worse unless, of course, you do something to prevent that. And that's kind of what exercise is here to do, is to help prevent the progression of Parkinson's disease. So signs and symptoms, as they relate to movement, the main four symptoms are tremors, typically starting in the hand, stiffness in your extremities and hips, slowness in movement, impaired balance and coordination. These are kind of what I mentioned earlier. These are the cardinal signs of Parkinson's disease, and these are kind of what you need to watch out for. It has a large impact on functional capabilities, making something very easy, like lifting a glass, writing your name on a piece of paper, opening a door, going upstairs, vacuuming, mowing. Mowing is, for example, something that's nearly impossible for people in this situation. Oftentimes, they need to have family or occupational therapists or someone that can help out. Um, Things like going up a staircase can be very fatiguing for them. It can be very hard on their legs and their muscles. They could even fall and result in even worse injury. So it's kind of scary. It's important that we get them into a lab or into a gym and start working on that skeletal muscle, building it up and improving their gait and lowering their chance of falling as we go. And then my last point, the combination of slowed movement and worsened balance usually results in needing assistance from people or something mechanical like a walker. So other symptoms, changes in speech or ability to write, restless sleep, trouble sleeping, even nightmares can occur, and fatigue and dizziness. A lot of this can also lead to some frustration, some confusion. They already have slight cognitive decline, so it takes them a little longer to understand what you're trying to say to them or something like that. And if you have to repeat yourself a lot, talking about an exercise, it can be frustrating. They know what you're saying, they hear what you're saying. It's just hard for them to translate it into an action or into a response. So that coupled with a restless night of sleep, some fatigue and dizziness when they wake up, it can make it very hard for them to exercise. These are barriers that can stop them from wanting to come in and exercise or wanting to exercise on their own when they're home. They might just want to sit down, they might want to relax, do something they enjoy. Primary treatment for it is physical activity and exercise to help control the symptoms. There is drug therapy that they can take. There are medications that can help with the signs and symptoms, but any type of drug therapy that is taken only really treats the symptoms that are happening currently and maybe can improve their functional movement for a little bit and improve their quality of life, which is good. But exercise is really the only way that we can delay that progression and stop it from getting worse, while also treating the symptoms, treating the things like the tremor and some of the rigidity and stuff at the same time. The effects of exercise. The largest impact is on the quality of life. We're affecting the loss in gait, the stability. We're improving their ability to walk around their house, walk to the gym, walk to the cupboard to get a drink and pick the drink up. We're improving the functional capacity. We're improving their ADLs. We're really helping them just live more effectively. It's also the ability to decrease the chance of falling to help ensure the prevention of any additional injury. Along with the additional injury would be more frustration, more even depression. Costs a lot more money. I mean, we're saving them a lot of stress on their body, stress mentally, if we can help improve their gait and prevent that fall. We can improve the tremors. This talks about the quality of life again, the tremors, which is a big symptom. Again, very frustrating. And then there's neuroplasticity and possible treatment. Neuroplasticity, we'll get into in a little bit on what that is, but that's just a way to help improve the neural connections, the neurons, and gain more control musculoskeletally. The best type of exercise. So the main type of exercise that we want to consider is flexibility training, range of motion, improving that range of motion that the muscles and joints will go through, like like a knee extension, trying to get their knee flexion and extension better so they can walk upstairs easier. The rigidity and stiffness are main contributors to the impaired gait and issues, so moving the primary joints like hips, knees, and ankles through the respective range of motions will make these movements a lot easier. That's what I'm talking about with their ankle. For us, we can move it, we can point our toes, we can lift our foot to the ceiling. For them, it not only will it take a little longer for them to make the movement happen, it's also going to be a lot less range of motion because they don't do the movement very often. Oftentimes they're very sedentary, and this can lead to the numerous cardiovascular disease risks, but also a lot more of that rigidity and loss of range of motion if they're just sitting for a lot of the time and their knees aren't getting full range of motion. Flexibility training daily or multiple times a day will yield the best results, but we should not push it too far. Hold for 10 seconds, utilize static stretches, and stay away from other types of stretching like dynamic and PNF. The staying away from dynamic and PNF is pretty self-explanatory. We don't want them doing a lot of quick movements, really just moving it that much at all, because the chance of falling is there. They could fall and hurt themselves. And stretching is something they can do at home, active, static active stretching, them stretching themselves if they can, if they have the ability to. If not, passive stretching can also happen at home. But we don't want them doing dynamic stretching at home and then hurting themselves because they're shuffling and they can't pick their feet up fast enough. And then we talk about not pushing them too far. They don't have the cardiorespiratory fitness. That's just their VO2s are going to be obviously very low. And we're also not testing them necessarily for VO2 right now, but we don't know what it is. We don't want to push them too far. We don't want to fatigue them. We want to increase that exercise adherence. We want them to enjoy it, not get discouraged, not be fatigued and resented. So what about the other forms of exercise? Patients with Parkinson's disease or any other type of debilitating condition need to consider the atrophy, decline in the muscles from the bed rest and lack of movement. They're just not using the muscles very much. They're not pushing up their body weight very often. They're not picking their feet up very high. So, the quadriceps are weakening, the biceps, the triceps. They're not able to eat a gallon of milk, for example. That's going to be pretty hard. So resistance training is obviously very good in offsetting the decline in muscle mass. If we improve the muscle mass or offset the decrease in muscle mass, it'll make these functional movements easier as well. So coupling resistance training with flexibility training is a really good way of making a movement like opening a cupboard and picking up a jar of jelly and putting it in it, or something like, or a jar of peanut butter and putting it in a cupboard, something like that. The same can be said for the cardiovascular risk and obesity that they may experience from the sedentary lifestyle. I alluded to this earlier. When they're sedentary, obviously they're not even walking from the back of a parking lot to the store and then walking around the store and picking up groceries. That's not necessarily a great form of exercise, but that's walking for 45 to 60 minutes in a day, and they're not even getting that. So their sedentary lifestyle is much higher, meaning the cardiovascular disease risks are going to be associated with that. Cardiovascular training or cardiorespiratory training will help kind of improve their cardiorespiratory fitness, improve their overall health, try and improve their VO2, help with any adiposity or obesity that they're experiencing. I have here walking. Obviously, we don't want them trying to run. And then swimming can be good for their health and socialization. Getting them into a swimming program might be able to make a lot of these motions a lot easier. It could be fun as long as they're able to do it safely and someone's there to watch them, and then they can interact maybe with more physicians or different physicians or caretakers or even other patients. How does exercise help? Parkinson's disease is associated with a decrease in dopamine that controls movement. Well, the dopamine doesn't necessarily control the movement, it's a neurotransmitter that helps the movement occur, as well as an emotional response. Exercise can reduce the chance that the neurons, the neurotransmitter, is damaged or reduced, and exercise does not have the means to increase the dopamine necessarily, but it has the ability to utilize the dopamine more effectively. So the reduction in the neurotransmitter, the neurons aren't getting the action potential, which is how the muscles move. They're not getting it to the muscle. Exercise can help get this transition from the neuron to the muscle and engage the muscle and use them and get better. Help the body get better at doing this technique. I have a slide here on what neuroplasticity is. This is the ability for the brain to reconnect and reorganize neurons in the brain, especially following an injury. So, exercise increases the brain's gray and white matter, which can increase the brain's capacity for neuroplasticity. So, increasing the gray and white matter will help give the brain the ability to reorganize and reconstruct neurons, even create new ones, help with the neurotransmission and stuff that I mentioned in the slide before. Form new connections between neurons and muscles, improving the movement. That's essentially what exercise is doing. That's what we're trying to do. Delay that progression of Parkinson's disease, fight back against the progression against Parkinson's disease while helping the symptoms, helping the underlying issue that's actually occurring here. It's unfortunately it can't treat it and cure it, but we can really help with alleviate a lot of the symptoms, improve the quality of life, and improve overall health. That's all I have for the slideshow. Hopefully you guys learned something new.